Now, we know that men and women in the medical field are working around the clock to provide the best care possible for coronavirus patients, but they still have to keep their own personal safety in mind. And with a shortage of personal protective equipment, those PPEs you hear so much about all over the country, one Valley nurse decided she simply couldn't risk it anymore. Team 12's Rachel Cole spoke with that nurse who said she made the tough choice to leave her job. Rachel?
Hey there, we spoke to a Valley nurse who says her frustrations and fears led her to leave her job.
I felt that if they weren't willing to take strides towards forward progress and correct policy, um, that that would leave me unemployed.
Hannah Borges spent her entire 14-year nursing career with Banner Health.
I didn't want to leave behind my colleagues either. I felt very sad that I felt like I couldn't reach out to people to tell them.
Most recently working with expectant mothers in the hospital in labor and delivery, where she told the hospital she only feels comfortable with PPE.
Instead of all hands on deck and let's do everything we can, it was we're going to tighten this up and we're going to take away your autonomy to protecting yourself.
As Valley hospitals prepare for possible shortages, they're taking stricter steps. In an email to 12 News earlier this month, Banner Health stating they're, quote, closely monitoring our stock of equipment and supplies and following guidelines that, quote, keep healthcare workers safe and avoid unnecessary use to preserve PPE. But Hannah felt it wasn't enough.
If I did return to work, that if there was a supply, that our use of it would be questioned.
12 News hearing from multiple nurses, lab techs, and healthcare workers across the Valley expressing similar concerns, though they've said they're worried speaking out could cost them.
I think that a lot of people are scared, and I think that they've made it clear not to talk to press.
Banner Health did not comment on Hannah's case specifically, but in an email last week said in part, quote, we have a centralized team that monitors concerns of this nature, and no team member has been suspended as a result of PPE misuse. For Hannah, though, the choice to leave hit close to home.
My brother was on a ventilator for a month, and I watched him suffer.
Before the COVID crisis, her brother died from a respiratory illness. Hannah said she simply didn't want to put herself at higher risk and hopes speaking out will make a difference.
All resources need to be used in order to fight this. I think that's the only way.
Hannah plans on going back into nursing one day. Meanwhile, Banner Health officials stated in an email earlier this month that their healthcare workers are their most valuable resource and that they're dedicated to keeping them healthy. Rachel Cole, 12 News.
Rachel, thanks.